Our next speaker is Lougene Marsh, who is the director of the Johnson County Department of Health and Environment. So you are in the good health and space of Johnson County right now. So thank you for being our host county and all of your wonderful staff who made this conference possible. Lougene is an incredible force at every table in Kansas when we are talking about transforming our system. She's a visionary thinker and leader. This is not in her bio. This is just what I know about Lougene. I appreciate and admire her work and her leadership in our state and regional efforts. And she became the health department director in 2009. And before that, she was the director of a health department, one of our two health departments in our state, well, only one now. There's a joint local health department, federally qualified health center. And so brought that experience, and before that worked for our state social services organization. So she has a breadth of experience, which may be why she is so wise when she shares her direction. And her master's degree is in public administration from the University of Kansas. So welcome, Lougene.
Thanks, Sonia, but I didn't use that visionary work to create a PowerPoint slide, so I apologize for that. But I do want to talk with you about sort of our journey in Kansas. And we haven't really been using the language of 3.0 because we got started a little before that rolled out nationally. And so we felt like we were probably challenging our 100 local health departments in Kansas enough with the language around foundational public health services that we will lead them in the journey to understand how foundational public health services and Public Health 3.0 are virtually the same. But this work really evolved from a group called the Public Health Systems Group, which is comprised of CALD, our State Association of Local Health Departments, KDHE, our State Health Department, Kansas Health Institute, the Kansas Environmental Health Association, academic institutions, and our Hospital Association. And this group came together to, well, it had been functioning for many years, but had an opportunity with some funding from the Kansas Health Foundation to really do a public health practice program initiative to look at what should we be doing in Kansas to sort of change the landscape and to improve our functioning as local health departments. Part of that resulted in a visioning summit that we had in 2015 and some key informant interviews. And some of the themes that emerged are really not going to be surprising to you. Some sort of challenges of the political landscape. This was back in 2015, and I think those have not resolved and maybe have become exacerbated. Sort of this fragmentation and lack of one voice. I know probably one of the things that local health departments have heard me say in many meetings when they would say, well, if you've seen one local health department, you've seen one local health department. I said, I really don't like that message. We need to say, this is what local health departments do. We need to speak with one voice. We need to have one model. So later that fall in 2015, our Local Health Department Association had its own retreat, and we developed a vision that we wanted to have a system of local health departments committed to helping all Kansans achieve optimal health by providing foundational public health services. And we developed a recommended implementation plan. We'd really been exposed to foundational public health services at that earlier visioning summit when a representative of the state of Ohio talked about the work that they are doing around foundational public health services. So our systems group really adopted that called vision and began our journey toward making this happen in Kansas. So one of the things that evolved was we really needed to say, well, what is our model? What's the Kansas model of foundational public health services? So through some literature review and conversations with other states that are already involved in this journey, we did develop that model. We also have formed a council on the future of public health in Kansas, which is comprised of state and local elected leaders, private health insurance, behavioral health providers, local health departments, of course, academics, and we really needed their advice and ideas on how we move this forward. Other components of that work really have involved a capacity assessment. So we really needed to know here in Kansas, in each one of our local health departments, how does what they're doing now measure up with this model of the foundational public health services. That capacity assessment has been completed, and we're in the process of having that evaluated, analyzed, and we'll have reports early May or in June. A second component of that, and we've sort of touched on this, Karen did, is a financial assessment about what would it cost to actually provide these foundational public health services in Kansas. Because you're exactly right. We don't have that dollar amount. We can't speak with one voice about what funding it is we need in order to make this happen. So that financial assessment, capacity assessment, each of those are happening. One of the things around the capacity assessment that I feel pretty confident we're going to realize is that with the number of health departments we have across Kansas and the size of them, some of them being very small, their individual capacity to do this work, provide foundational public health services, is going to be compromised. So we've done a lot of work in Kansas and have had a lot of conversations around cross-jurisdictional sharing. So we'll be looking at whether that may be a model for helping us move this forward. We also realize that our public health statutes in Kansas are out of date, antiquated, so we're doing some analysis of that, looking about what that should look like. And all of this assessment work is scheduled to be completed in June, with final recommendations developed this fall. We have a grant application that I think it's actually being submitted this week, that we are hopeful that we'll be successful with that to help us continue this work, because our funding from the Kansas Health Foundation is ending in June of this year. One of the other pieces that we're working on is to actually present this information to boards of county commissioners, which for the most part in Kansas serve as the boards of health. And so that's planned for this fall, to really bring them along with this conversation and help them understand what a foundational public health services system in Kansas could look like, and hopefully begin introducing them to the language of Public Health 3.0 as well. So I think my time is up, and be happy to listen to the questions.
Thank you, Lougene.